Good day everyone, it's a great pleasure to see you here today. Today my topic, herpes zoster. Herpes zoster or shingles is viral infectious disease that affects the skin and nervous system. It is characterized by painful vesicular eruptions distributed along sensory nerves. The causative agent of herpes zoster, varicella zoster virus, which has a strong affinity for the nervous tissue. And this virus also causes chickenpox. After a person recovers from chickenpox, the virus remains dormant in sensory nerve ganglia and reactivate years later, producing herpes zoster. Now let's focus the etiology. The etiological agent is varicella zoster virus. This virus belongs to the herpes virus family and has strong affinity for the nervous tissue and persists in a latent form in sensory nerve ganglia. The disease herpes zoster more frequently occur in elderly individuals, patients with chronic disease, and immunocompromised patients, and individuals under stress or fatigue. The disease can transmission from direct contact with vesical fluid and airborne exposure from active lesions. And the disease has two clinical stages, eruptive stage and prodromal stage. And the disease is less contagious than chickenpox. Prodromal stage characterized by burning sensation, itching, and pain along sensory nerves, and fever and malaise. And eruptive stage characterized by erythematous patches, grouped vesicles, and painful blisters distributed along dermatomes. Herpes zoster has the following clinical forms: vesicular form, more thin form, and characterized by vesicular by painful grouped vesicles along on the skin, and hemorrhagic form. The vesicles are red and blood-filled, more severe and painful, usually seen in immunocompromised patients. And gangrenous form, the vesicle show tissue necrosis, mild and tissue necrosis, and mainly seen a patient with severe immunodeficiency. Abortive form, the vesicles spread all abortive form characterized by this form mild and less painful and short-lived, less painful. Generalized form, the vesicles spread all over the body and severe clinical course, and usually seen in immunocompromised patients. The location The vesicles located in the abdomen, in the chest, back, neck, shoulder, neck, abdomen, and shoulder, and face and eyes. Possible complications include postherpetic neuralgia and secondary bacterial infections, ophthalmic complications, and rarely in meningitis and encephalitis. Treatment. During the disease, used antiviral drugs, acyclovir, valacyclovir, famciclovir, pain management, analgesics, painkillers, and anti-inflammatory drugs such as ibuprofen, naproxen, and local treatment include antiseptic solutions and drying agents. The preventive measures include avoid direct contact with infected person, strengthening the immune system, and vaccination with shingles vaccine can effectively prevent the herpes zoster. This disease in Azerbaijan is popularly called night bird.